And this is Dr. Greg Campbell, and welcome to Tooth Talk Thursday. This is episode 8. I'm very excited to let you know we're opening up on Monday, June 1st to see you, our patients. I've said all during this COVID-19 pandemic how much that I miss you, and I look forward to seeing you. And now I get to start seeing you on June 1st. All the team is back. We did our training on Thursday. We have many different mandates and protocols to follow. And as you know, our office has always met or exceeded greatly the infection control guidelines. And I've said in previous episodes, our office is one of the cleanest places, if not the cleanest place you can be anywhere you go other than a surgical center. So we are very, very excited. I am incredibly excited that you're going to be joining us and where our doors will be open on June 1st. So that's the big notice that we're having. So I'm going to pause here just a little bit so more people can log in to see what's going on with our Tooth Talk Thursday. Obviously, I'm a day late because we did our staff training yesterday and I didn't want to record it. I wanted to do this live. So again, we're very excited. I mean, you can tell, look at that, I got dimples. I'm ready to go. We are ready to see you. And I wanted to go over what we've done, the changes that we've made to welcome you back into our practice. California is really slow to opening up. I'm in Los Angeles County. Much of the county still isn't open, but in Long Beach, I am opening on June 1st. So it's going to be a little different. What we're doing is about 3 days before your appointment, we are actually calling you. We're also sending you a link. And on that link, it's going to ask you a series of 6 questions dealing with if you've had a fever, if you've been around anyone that's been infected with COVID, a shortness of breath, all these questions that you've been asked numerous times. And it's important that we want you to know that when you come into our office, we are doing our very best to make sure that not only is our team healthy, but that we have healthy patients in the practice. And so all of our team will have their temperature taken. They'll be asked the same questions. And if there is a fever of over 100 degrees, we're going to ask our team to go home, as well as we'll be asking you to go home as well to reschedule. So hi, Mark. Thanks for joining me. I think it's great that you're here. So what we're going to do is the day of your appointment, we're going to ask you to arrive and call us when you've arrived to our location. When we do that, we'll tell you when the right time is to come in. We're going to use our waiting room as a triage area where there's a barrier there. You've seen these everywhere. We're going to actually go ahead and take your temperature. We have the IR temperature. It's a touchless. We're going to be doing it on your forehead. We're going to check your temperature. We're going to be recording it. And then we're going to ask you on an iPad a series of those 6 questions again and record your temperature. While we're doing that, we'll be giving you some hand sanitizer. I know you guys have seen this everywhere. We are so hand sanitized out, but we have tons of it and we're ready to give it to you. You're going to put that on, and we're going to also ask you to wear a mask into the office. So you have to have a mask to come into our office. That's to protect you. It's also to protect our team, and we want to help do our part to get past this pandemic in the best possible way. So now we've got you in the front. You've answered all the questions. We're going to now escort you back to the treatment room, and before you sit down, we're going to ask you to do a pre-rinse. We have a special rinse that's hydrogen peroxide based, that's flavored, is to allow you to just kind of lower the bacterial count, the viral count in your mouth. And then we're going to take care of you like we always do. Some of the interesting things you're going to notice in the office is our team is going to look a little different. They're the same people, they just have more gear on. So we've really gone through the Center for Disease Control, Cal OSHA, some of the recommendations from the American Dental Association, and man, I'll tell you, the California Dental Association has been amazing on this. Hi, Frank, I'm glad you're here as well. They've given us all these suggestions to really provide the safest treatment area possible, and a dental office is incredibly safe. So we want to try and cut down on the dental aerosols. So the team is going to be having some face shields. Some of them look like this right here. Also, a gentleman who's on here right now, Frankie Acosta, we did some face scans of some of our patients, some of our team, and he was kind enough to print out mask fitters, which actually seal the masks, which makes our team even safer. And so I thank you very much for that, my friend. And so we have face shields that you're going to see people wearing, including our hygienists, and we're going to be, hand washing protocols. We're going to be using our high volume evacuators to reduce aerosols. We're doing everything to take care of you. And my biggest concern is during this, we've had people who've had small fillings who've now turned into larger restorations like the crowns and onlays we've spoken about. And we've had some people who've had the need for maybe a larger restoration that's turned into a root canal. And then some people who needed root canals and couldn't get in for care or elected not to have the care now have turned out to have some teeth removed. And as you know, what we want to do here at our office at Greg Campbell DDS, we always do our best to be preventative. We're interventional. We want to prevent something from happening or getting worse. And so in dentistry, nothing gets better over time. It doesn't. And so what we're trying to, hi Eric, I'm glad you're here as well. So what we're doing with our protocol is we're doing our best. We've always taken great care of you. And again, I'm so excited that you are going to be here. If you guys could do me a favor who are on here, Mark and Eric and Frankie and Jen Kim, if you could actually type in where you're listening from, that would be a tremendous favor for me. And also, if you're enjoying this Two Talk Thursday, if you would be kind enough when we're done, if you'd be kind to share this, that helps us get out more into the community. And we're averaging around 6,000 views for each one of these. And so it's because of you, my audience, and I love reaching out to Long Beach and taking care of our patients. This practice has been here since 1924. Not me. I've not been here since 1924. But this practice, I'm actually third generation. It was the McBride practices I gave the history of before. I'm not a McBride. I would be honored to be one. And their father started it, and then the two brothers worked it, and I bought the practice from them. So once we finish, going back to the patient flow, once we finish your care, we're going to do everything. We're going to be doing more work on you during the appointments. The appointments might be a little bit longer. And so we ask you to show up 10 minutes before so that we can walk you through the office like I told you a few moments ago. And again, if you have a temperature of over 100 degrees, we are going to reappoint you. So that's a pretty standard thing, is that we don't want men with a fever, as well as we don't want our team to have a fever. So that's a pretty good understanding across the board what we're going to be doing on that. Once we complete your care, we're going to actually give you some hand sanitizer or allow you to wash your hands. We're going to ask you to put your mask back on, and then we'll escort you up to the front to check out. And we're going to try and do as much of a checkout-less procedure as possible. We've been working on that. And I think you're going to find that it's pretty smooth and efficient. The one thing I want to ask you, my great patients, is we have a huge backlog of patients. By my estimates, it's somewhere around 500 patients that are past due for their cleanings. We have people already scheduled for the cleanings. So we're trying to rob Peter to pay Paul here. Please be patient with us. Call us if you have some urgent needs. We're trying to shuffle the schedule around. We're trying to extend our hours a little bit to accommodate for that as well. So please know that we are aware of this. We're doing our best to take care of you, and we will. We're definitely going to take care of you. So I wanted to go over the infection control stuff. I talked to you about that. This office, we painted it. Actually, we painted it twice because I was bored and I made a mistake on the first paint. My daughter's coming in and fixing this up. We've disinfected the office from top to bottom, and the crew just finished. So this office looks brand new. And finally, the other thing I wanted to let you know is we put HEPA filtration system into the office. We have 7 systems, one for each operatory and the waiting room, as well as some other areas in the office. Our air is cycled every 6 minutes in the office. 6 minutes, that's incredible. So you are going to be in a very healthy situation here, and I'm excited to share that with you. So our office, which already had very high standards, now has even higher standards, and I'm pleased about that. We also had a meeting yesterday morning with the team, as I told you. We had a company come in called Breathe Right Environmental, and they did fit testing for all of the employees that wanted to do that, to wear the N95 masks. And so we had 10 or 8 people do that. It was incredible. This guy was amazing how he's talking about how to wear these properly and what's the best practices. And so I'm glad that we were able to bring him in, and that helped my team as well to feel even more comfortable coming back. So we're ready for you. I'm more than ready for you. Feel free to give our office a call, 562-988-0148. And this is Dr. Greg Campbell, and thanks for watching Two Talk Thursday. I look forward to seeing you soon. Bye.